You're listening to Health Professional Radio with Wayne Buckler. Today my guest is Chris Massis. Chris is the CEO of the Australian Physiotherapy Association and joins us from Melbourne in Australia. Welcome to Health Professional Radio, Chris.
Thanks, Wayne. Thanks for having me.
It's a pleasure. We always like to have a chat to the various associations and registration boards and bodies. Chris, tell us a little bit about the Australian Physiotherapy Association.
Sure. The association in Australia is the peak body for physiotherapists. There are in Australia 26 to 27,000 registered physiotherapists in the country here, and we're the peak body, so we cover the professional issues. We have an advocacy function. We also have professional development, and we also provide a range of member services such as insurance and discounts to products and services and the like. So we're a peak body, multidisciplinary. So we cover a whole range of physiotherapists that work in different settings in community settings, hospital settings, the private sector, and also in academia.
Chris, is the Australian Physiotherapy Association also a registration body?
No. In Australia, the government has a regulation process for a number of professions, and physiotherapy is one of those. So any practicing physiotherapist in Australia needs to be registered with the national regulator, and then membership of the APA is an optional thing. So for us, our challenge is really demonstrating member value. So physiotherapists choose to belong to the APA rather than are obliged to join. And
you're a not-for-profit body governed by a board of directors?
Correct. So structurally we're a company limited by guarantee, but we are a not-for-profit. We do have a board of directors with 8 directors currently. 6 of those are physiotherapists, but we're also quite contemporary. We do have 2 what we call independent directors, so non-physiotherapists who have either a finance or a marketing background to just help us govern the organisation in a contemporary way.
That's would tick the box for good corporate governance, I would have thought, these days.
Yeah, look, absolutely. I think we pride ourselves on good corporate governance. We make sure our agendas are strategic. The board, manage the strategy of the organisation and the governance, and then they let management cover off the operations and the application of the strategy onto the organisation. So I think it's a really good balance.
Now, Chris, as you're probably aware, most of our audience are clinicians in one form or other, and including a lot of allied health professionals, which catches the physiotherapists in that sort of catch-all description. What's the takeaway message that you'd like them to take away from our chat today?
Yeah, look, physiotherapists pride themselves on being multidisciplinary, so really working as part of a care team. So although physios, are skilled in diagnosing, treating, and working in different elements, I think they can add value to lots of care teams, whether it be things that are emerging and chronic, the burden of disease in Australia around arthritis and diabetes and back pain, for example. I think physiotherapists can be a real asset to a care team, perhaps led by a GP or a medical professional, and then spotted along with other allied health professionals. I think that's the key takeaway message for your audience.
And I guess with ageing of the population, there's an increasing demand in aged care as well.
Absolutely. I think one of our growing segments is our members working in not just nursing homes, but care at the homes as people age and probably age in their own environments, in their own settings, on their own terms. So I think this government here is really big on consumer-centred care packages, and I think allied health and physiotherapy and the manual therapies will be a big part of that in the future.
Yes, a number of people that I've been talking to recently in various interviews have been talking about the very rapid emergence of ageing as a major issue in healthcare in Australia. So,
yeah, and I think the expectations is we don't age we want to age well, so we want to be stronger and fitter and be functional, so we want to prevent falls, we want to be able to be self-sufficient, so have your own shower, being able to dress yourself, and I think having the ability to do that can really be enhanced with key help from allied health professionals.
Chris, in every occupation that I talk to and pretty much everyone I talk to, I'm always interested in what are the misconceptions about their work that drive them nuts and keep them awake at night. What are the misconceptions that you worry about?
Oh, look, I think for physiotherapists, what our members tell me is that the consumer or the public still think of physio as maybe glorified massage, if you like, and it's a lot more than that. They're actually quite skilled in their research, their education, their evidence-based, their knowledge of anatomy, that they can actually do some really good and exciting things for people to actually get moving again. So they're not just almost a rehab type profession, although that's a big part of it. I think the new age of wellness and preventative is also a big part of what a physiotherapist can deliver. So almost that holistic care rather than I've got a sore leg, can you give it a rub? And
of course there is an ongoing professional education program.
Absolutely, yeah. So there is a requirement as a registered profession, as you know, to have a certain number of hours per year. So the public can be rest assured that there is certain skills and upskilling and I guess a development required to maintain their registration.
Yeah, and I guess for a lot of people they're referred to physios through other agencies. For those people who are not referred, can you identify an APA member?
Yes, absolutely. We have a website where we have a find a physio function, so you can search by postcode or even by language spoken or by condition or specialty. So if your listeners want to visit physiotherapy.asn.au, and there's a find a physio function on that, so the general public are most welcome to search that.
Because I'm always getting into trouble for mentioning websites and phone numbers too quickly, I'll just fair warning people. Pencil's handy. It's www.physiotherapy.asn.au.
Perfect. Thank you.
Chris, is that the best way for people to get in touch with the association?
Yeah, look, that's our website, and there is a link to the Find a Physio link there. So, and if they have any questions, absolutely, there's an email address and the phone number there.
Chris, thank you very much for being with us this morning. It's been informative to hear about the APA, and it's nice to know that there is a finder function there for people who are looking for qualified members of the association.
No, thanks, Wayne, and thank you for the opportunity to profile the profession.
Now, you've been listening to my discussion with Chris Massis, who is the CEO of the Australian Physiotherapy Association. We have a transcript of this interview on our website at www.hpr.fm. You can also find the audio on our website or on YouTube, and that's available on an ongoing basis in our archive. This is Health Professional Radio. My name is Wayne Buckler.